Welcome to Meet the Docs with your host, Grant Otten, brought to you by Columbus Community Hospital.
Welcome to another edition of Meet the Docs, sponsored by the Columbus Community Hospital. I'm your host, Grant Otten, joined by Dr. Luke Lemke today. Doctor, how are you doing?
Very good, Grant. Thank you.
Well, it's good to talk to you in this setting. I know you from outside of Meet the Docs, but it's good to talk to you here. Let's start a little bit talking about what it is you do here in Columbus at a Columbus Medical Center.
Well, I've been here at Columbus Medical Center for since 1990, actually, is when I came, and I'm a family physician. So what that means is we take care of people from birth till they die, and the family is included. We really try and include the entire family because so much of what goes on in our health is related to our family and our social interactions and what we call our social determinants of health. And so I think the family physician, that's what got me interested in it, is because of all of the different things that play into people's life. I'm not just looking at one organ system or one specific thing. We're looking at the whole big picture. So I feel like that's really what we do here is, and all family physicians really try and do is take care of that entire social network we call the family.
And this practice has a lot of history for you, not just because you've been here for a long time as a doctor, but
right.
Even from when you were a little kid and your dad was working here. So can you talk a little bit about that?
Yeah, it's a great question. I mean, I was thinking about that this morning. 1953, December 7th, 1953, my father opened the clinic with two other physicians in this very spot that we're standing. So it has a very unique experience for me. So for 64 years, there's been one of us practicing in this area. So it's very near and dear to me. And I can remember coming here as a little child and getting sewn up in this very room that we're standing in. And now I'm sewing up other people in this very room. So it's a really circle of life almost.
And so you're a family practitioner, but lifestyle wellness and day-to-day wellness is a big effort for you and a big push for you. Can you talk a little bit about what that is?
Yeah. How long do we have? No, I can talk about lifestyle, and I think it's a natural progression, I guess. And what we're looking at here is what kind of gets me up in the morning. It's kind of what gets my juices flowing. Again, medicine is really right now is about disease care models, and what we're trying to look at is the other side of the spectrum. How do we take care of people before they get sick? 80% of what we take care of right now is preventable, between heart disease, cancer, diabetes, stroke, dementia, and 80% of that is preventable by things that we do every day in our lifestyle choices. We make hundreds of choices just on what we eat every day and what we do, and if we can make some differences on those little things that people do and get them the right information, then we can prevent some of the diseases that we're trying to take care of.
Is that something, and now you're working with the chamber on the chamber board, and that's part of your push with them too? So is this something that not only you're talking to your patients about, but you're just trying to get a community-wide push for this?
Absolutely. So two ways we can approach those kind of health and wellness. You can do it on an individual basis, and you can do it on a population basis or an environmental basis. If you teach people how to live healthier lives and make healthy lifestyle choices, but you don't give them the environment to succeed in that, then you're not going to have the success. So I think Columbus is a very progressive, unique community, and if we can make some improvements, which we already have, there's great things going on in Columbus. And what I'm trying to do with the help of the chamber and such is to coordinate that all, to bring all those efforts together in a unified way to help make Columbus a healthier community.
So I guess tell me a little bit about what you're doing with lifestyle medicine through the hospital.
Well, that's a great question, because we do have a program that has been up and running now for a couple of years called the CHIP program. It's called Complete Health Improvement Program, and it's really it's a really very, very individualized session that we've launched as a pilot program at the hospital, and we've had probably 50 or 60 or more people go through the program. Now it's 12 weeks, twice a week for 6 weeks, and then once a week thereafter. And it basically focuses on lifestyle choices, diet, exercise, stress mitigation, adequate sleep, and some very important things that we need to address. So it's not a diet plan, it's not a weight loss plan. It's about making improvements in your lifestyle that will impact you. And we've seen some great measurable results. There's a lot of things that say we'll do this and this, but we have the data to now prove that. And so it's a very exciting time, because the hospital has been very supportive of this. It's not something you take lightly. It's something that you have to commit to. But once we launch this to the community, I think we'll start making some of those changes. So we work from the individual to see people, help them to make those changes, and then on a community-wide basis, hopefully we can start to see some of those environmental changes. So the CHIP program is kind of grassroots, helping people make some of those lifestyle changes. We don't know what to do with our fruits and vegetables that we're growing. we teach people how to do that. We have some great things that we do to teach people how to eat healthier by cooking healthier.
And I guess the philosophy behind that is that to make sure it's something that it becomes a long-term change where someone can continue it afterwards. Because I think a lot of people maybe will even look at the weight loss or becoming healthier. It's like, I'm trying to do this for 12 weeks to reach the finish line, but really it sounds like it's something that you're trying to propel people for the long term after you're done.
Well, absolutely right. I mean, that's just the first step. In fact, we have a commencement, and commencement doesn't mean to stop, it means to start. And so our commencement is the start of their healthy lifestyle improvement. One of the founders one of the people that I look up to is a guy named Kim Williams, and he's the start of, he was the president of the American College of Cardiology, and his statement was, I know I'm going to die, but I just don't want it to be my fault. And I think that's kind of what we're trying to impress through CHIP, is we were going to try and help people to feel better and to live longer, happier, healthier lives.
Dr. Lemke, thank you very much.
Grant, thank you. Appreciate it.
We thank you guys for tuning in as well for another edition of Meet the Docs. For Dr. Luke Lemke, I'm Grant Otten from News Channel Nebraska. We'll see you next time.